Let us now talk about the mechanism of labor in face presentation. The mechanism of labor is very similar to that of the vertex presentation, except that due to increased uterine contractions, extension increases. In normal, due to uterine contractions, it is flexion increases. This time it is the opposite, it is extension increasing, and therefore when extension increases, the chin becomes the leading part instead of the occiput. This time the chin becomes the leading part. That is why in face presentation we talk of right mental, left mental. It is the chin which is the leading part, and this chin is the one which rotates forward, and the head, instead of being borne by flexion, this time the head is borne by extension. We are going to look at it. So in this case, the lie is longitudinal, the attitude is extension, the position is left or right mental anterior, which is the commonest we shall talk about. The denominator is the mentum, and the presenting part is the left molar bone. The presenting diameters are the submental vertical, which is 11.5, but as contractions continues and more extension occurs, it will be the submental bregmatic, which is the 9.5, which will engage. So, due to increased uterine contractions and retractions, descent will take place, and it will increase the extension, and the mentum will become the leading part. As the mentum becomes the leading part, it will reach the pelvic floor muscles, and it will rotate 1/8 of a circle forward to lie under the symphysis pubis, and with further extension, the chin will escape under the subpubic arch. So more flexion will take place, and then the sinciput, the vertex, and the occiput, and the occiput will sweep the perineum, and then the sinciput will escape under the symphysis pubis, and the head will be born. We said, as usual, like in vertex, restitution will take place, internal rotation will take place, external rotation, and then flexion will take place. So, can you listen to this? Face presentation, and I'm going to describe the mechanism of labor by face presentation. So on description, the lie is longitudinal, but this time the attitude is that of complete deflection. The head is completely deflex, meaning that it is the face entering the pelvic brim. So by face presentation, we shall have the denominator this time as the mentum or the chin, and we shall have the engaging diameter, that is the submental bregmatic. When we talk of the submental bregmatic, its distance is 9.5, and it is the distance which is going to enter the pelvic brim in the oblique diameter of the pelvic brim. Remember, the oblique diameter of the pelvic brim is 12 centimeters. Therefore, it will be easy for the 9.5 to enter. So by face presentation, we shall have 4 positions. The mentum can be either on the right or on the left mental anterior position, or it can be the mentum, it can lie posteriorly. And we are having left or right mental posterior. So these are the positions we are going to talk about. So at the beginning of labor, of course, it is the mentum that presents. And we said it can present either mental anterior or mental posterior. So If it is right or left mental anterior, we shall have increased uterine contractions and retractions, and of course descent will occur. And when descent occurs, it will be the mentum which will reach the pelvic floor first, and then it will rotate an eighth of a circle. And when it rotates anteriorly, we shall have the mentum anterior. This can be the same even when it was on the opposite direction, and it rotates an eighth of a circle to bring it mental anterior. But even at one time, we can have the mentum coming in when it was right mental transverse, when it was in the transverse area, and it comes and reaches the pelvic floor. Here, it will have the rotation of 2/8 of a circle, again to bring the mentum anterior. So when we have mentum either right or left mental anterior, it rotates an eighth of the circle to come, the mentum to come to mental anterior. Or when it was transverse, it will rotate 2/8 of a circle anteriorly, again to bring it mental anterior. So first of all, these are the normal changes which we can look at. We shall look at another one last. So when the mentum comes anterior, here we are going to deliver this head by two mechanisms. The mechanism, one is extension and another one is flexion. What happens is that we shall try to push this mentum to continue to extend. And as it extends, it will be able to impinge over the subpubic arc or under the symphysis pubis. So if it impinges under the symphysis pubis, then this is extension. Then we shall come and have flexion. So that is why we say here we use two mechanisms. Extension first to deliver the chin, and then flexion to deliver the occiput. It means the occiput will sweep over the perineum, and the face, the chin, the face and the synciput, they will escape under the symphysis pubis. So in normal mechanism, after this step, of course restitution will occur, and this head will undo the twist which was done in the beginning. And then at this time, the shoulders will engage. And as shoulders engage, they will also reach the pelvic floor, resistance of the pelvic floor, and they will also rotate an eighth of a circle. So here, during rotation of an eighth of the circle, we shall have internal rotation of the body and then external rotation of the head. The two will occur simultaneously. Rotation of the body and external rotation of the head. Then at this time, the shoulders will be lying in an antero-posterior diameter. They have the birth of the shoulder and the birth of the baby by lateral flexion. So